October is the month of World Breast Cancer Awareness, and on this occasion we have Dr. Anupama Borkar with us, who is the HOD of Medical Oncology at GMC. Good evening, doctor. Can you hear me?
Good evening, Sachin. I can hear you.
That is wonderful. It's so nice to hear your voice now.
Thank you.
So tell us a little more, doctor, about the World Breast Cancer Awareness Month that is being celebrated. So to start with, let's start with the very basic things. How serious is this issue of breast cancer in India, in Goa, and in the world by and large?
Yes, so breast cancer is the commonest cancer in women, and it is the commonest cancer in Indian women too. It is so common that 1 in every 8 women is likely to develop breast cancer in her lifetime. So in the year 2018, India reported approximately 1.6 lakh new cases of breast cancer. And in Goa Medical College, we have approximately 100 new patients diagnosed with breast cancer every year. So yes, it is common, and it is more common than we would like to believe.
Right. And how serious it is? I mean, is it?
So breast cancer, like any other disease, is treatable. And if patient is diagnosed in the early stage of the disease, she can be completely cured. But unfortunately, most cases in India, at least around more than 50%, are diagnosed in the late stage of the disease, where it becomes difficult to cure them. And that is the importance of awareness. If we can increase awareness about breast cancer, then we can have women who have some symptoms to report early. We can diagnose it in the early stage, and we can cure it. Right,
doctor. And how or what can one do, to find out that it might possibly be in the early stages? Are there any indications? Are there any parameters for a person to individually find out?
Yes. So the most common symptom of breast cancer is a lump in the breast. This lump is usually felt by a woman while dressing or bathing, and it is most often painless. And that is why most of the times women tend to ignore it and say, oh, it doesn't hurt. But a lump in the breast should always be reported. You should report to your doctor. Now, the other symptoms could be a change in the size or shape of the breast, that is any swelling or any shrinkage of the breast. It could be any change in the size or shape of the nipple or retraction of the nipple. It could be a change in the skin overlying the breast, where there could be some dimpling or puckering of the skin, or any discharge from the nipple, especially if it is blood stained. So these are some of the symptoms that women should be aware of, that they should look for, and if they find any of these, they should report to a doctor immediately.
Right. And is there any particular age group that is particularly susceptible to it?
So conventionally, we used to always think that breast cancer is a disease of elderly women or above 50 years of age. But in the last 2 decades, we have seen more and more young women getting affected. And we have seen women in the early 20s also presenting with breast cancer. So it really doesn't spare younger women. And so right from the age of 20, every woman should be aware of her breast, should learn about breast hygiene and breast health, and report any symptoms if she finds any.
And largely, what kind of treatment is there? Is it a long process? Of course, it would depend on which stage it has been diagnosed.
Yes. So the treatment of breast cancer is what we call as multimodality treatment. So we use a combination of surgery, there is chemotherapy, there is hormonal therapy, then there are certain targeted drugs which are very specific for breast cancer, and there is radiotherapy. So depending on the age of the woman, the stage at which she has presented, the specific nature of the breast cancer in her body in terms of presence of certain receptors like hormone receptors and HER2 receptor, we decide the treatment. It is tailored to every woman depending on all these factors. And as I said earlier, if women come in early stages, it is very highly curable. If they come in advanced stages too, there is a chance of getting cured. If not, it can definitely be controlled with therapy. And all of these treatment modalities are available in India. They are available in Goa. In Goa Medical College, treatment is free of cost. All we want is women to come forward and get treated.
All right. And is there any basic precautions that women could take against it?
Yes. So we now know that apart from certain factors which really cannot be modified, which are responsible for breast cancer, there are also some factors which can be modified or which can be controlled. For example, sex. Being a woman makes you more prone for breast cancer than being a man. Increasing age puts you at risk for breast cancer. If there's a family history of breast cancer in a first-degree relative, that makes you at risk for developing breast cancer. Then the age at which a woman achieves menarche, that is starts period, and the age at which menopause is achieved, also contributes to breast cancer. But these are factors which we cannot change. But there are factors which are in the control of every woman. So these are things like obesity. It is known that being obese increases the risk for breast cancer. So one can be conscious of your weight, and you can practice healthy eating habits, regular exercise to keep weight in check. Then the age of pregnancy. So women who have never had children, given birth, and never breastfed are at higher risk. Similarly, women who have had their first pregnancy late, that is after 35 years of age, are at risk. So having pregnancies earlier would be a protective factor. Most important is the use of tobacco. Tobacco has been proven to be responsible for cases of breast cancer apart from myriad other health hazards. So absolute avoidance of tobacco, avoidance of alcohol, avoidance of prolonged use of oral contraceptive pills, and an overall healthy lifestyle can definitely help us to reduce the incidence of breast cancer in society.
Right. When you say tobacco, as in tobacco in all forms, whether it's in cigarettes
right.
or...
So it is smoking as well as smokeless tobacco. So in our country, the use of smokeless tobacco is more than that of tobacco which is smoked, which is BD or cigarettes. So smokeless tobacco like in gutka, pan masala, these are responsible not only for cancers of the mouth and the tongue and the lips, but also for breast cancer.
All right. Thank you very much, Dr. Anupama Borkar, for enlightening us about breast cancer and considering the fact that this is World Breast Cancer Awareness Month. We thank you very much once again for joining us
on
the show.
For having me.